Recording. So again, I welcome you all to today's Wellness Wednesday question and answer session. You know, over the weeks and months, different members, clients, customers, guests have had questions, and we have decided to take one day in the month to answer some of those questions and throw more light on some of the conditions that the questions are related to. And so I'm going to go ahead and share some of those questions so that we will start to answer them. So, and our panelists, I know you're ready for us. And so I'm going to put up the first question. So the first question says, what can a woman of 79 years who with an irregular speech who can't lift her right hand and left leg use? So any of the panelists can go for that.
Okay, I would like to go for this.
Please
Can
go
you hear
ahead.
me, ma'am?
Yes, please go ahead.
Okay, so a woman of 79, irregular speech, who can't lift her right hand and left leg. So I know we have done something in the past that is not making, we are not trying to make everybody a doctor, but at least we should be able to identify one or two things when we hear people's complaint. So in this scenario now, we are looking at two things. Number one is the age of this woman. She's 79, so she's elderly. She's an elderly person, so we hold that one side. Then she has irregular speech, and she cannot lift her right hand and left leg. So most likely, this woman has had stroke before. Must have had stroke one time, but probably must have resolved. So she must probably maybe have hypertension at a time too, or diabetes, which we are not sure. But one thing that is certain is this woman is an elderly person, and she must have had stroke before for her not to be able to talk properly and lift the hand and leg. So there are different ways we can approach this with our products. We have a pack that is like in the hypertensive pack that has quite a lot of things that this person can use. If this person is confirmed to be hypertensive or diabetic, we have that pack that this person can use. But if it's someone that cannot afford all those packs that we have, we can simply put this person on our antioxidant liquid, as I fondly like to call it, which is the bitters. That is number one that we can give this person. Then because of the age, one of the things that I started doing recently is anybody that is aged this way, I always put them on restore, irrespective of what I'm giving them, but I scale the dose. I'll put them on restore because of the age, then I'll put them on our bitters. And if there's any co-infection that has tipped this person into that sickness, there's a space for cleanser. But if you are going to use those things together, you have to know that there should be spacing. You will not just rush everything together. So two things, the bitters is very, very powerful in this person, either the bitters capsule or the liquid. The restore has a place because of the age of this woman, even though if she's not in the childbearing age and all, but because of how the restore has effect on making a woman to look younger and reverse the genetics and all that. Then you can go for any of our adult pack or hypertensive pack or elderly citizen things that will give them. So I would like to leave it here. Right.
Thank you very much, Dr. Onifade. Would you like to contribute anything to that?
Yeah, so I think Dr. Onifade has said it all. I mean, within the pack, we also have the balm. Sometimes, just massaging the area would also, in addition to taking those things orally, would also contribute in helping to mobilize, those parts that are not being able to be lifted currently. So I just wanted to add that. And I also want to assume that the person is also seeing his or her doctor, of course, which we always talk about here.
Thank you very much. Yes, it's so true that we don't just go and give those medications or supplements, it's important that there's actually a diagnosis. The woman should have seen her doctor, so that we actually know what we're treating or what we're helping to manage. Thank you very much. So we'll go on to the next question. The next question says, do you have anything to fire up nerves? I have slow reflex on my left fingers, and after lifting 3 kegs of palm oil of 25 liters each. So that's the question. Anybody can go for that. Maybe MI.
I don't really understand. I mean, I've seen this question before and I was like, okay, I don't really get what it is. Fire up the nerves. And then the experience looks like a one-off kind of experience. I mean, the person lifted 3 kegs and then, maybe something, maybe the nerves, I don't know, maybe there was a, what would I call it? Like an overwhelming effect on the nerves. I mean, if it's something that has been on for some time, the person needs to be examined. I don't think guesswork would, fire up nerves. I don't really know what that means medically and all. So, I mean, it's proper to get to the doctor, get examined and know exactly, what the issue is. Maybe take the person may need to go through some level of examination to know exactly what it is. So that would help. But like Dr. Nufade said, antioxidant liquid, which is the bitters, you can't go wrong with that, and as well as applying the balm. But it's important, just check what's the real issue, so that, you're not just shooting. Yeah.
Thank you very much. Yes, I know these questions are there and it's intentional. They're there. We put them there so that just to be able to help our members and even guests to know that it's important to see your doctor. It's important to have yourself examined to know exactly what it is. Definitely, RIDA has a role to play. Part of the RIDA range has different components of the RIDA range have roles to play, but it's very important to know exactly what we're dealing with. Thank you very much. I think Dr. Onifade may have gone off. Okay, maybe the network has thrown him out temporarily, but we will go on. Now, what do you recommend for a 60 to 63-year-old person for brain perfection? Sometimes he forgets things so easily. Well, maybe I should start the ball rolling with that 63-year-old person who forgets things easily. People who are even less than 60 to 63 forget things easily. But if it's pronounced, again, one would recommend that the person sees their doctor. Of late, dementia, Alzheimer's disease has become quite common, but what I would say is that RIDA bitters, the antioxidant liquid, you cannot go wrong because it does help for the nervous system as well. So Emma, I don't know if you'd like to comment also.
Yeah. So, well, I wanted to also mention, of course, that it's part of the aging process. Some age faster than others, and we've also discovered also in time that this is happening a lot earlier for people these days because of lifestyle changes, because of diet and all of that. And nature has so done it that there are even things that can be included in diets, a few modifications that can be made to to slow this down, and so that it doesn't degenerate too fast. So there's a dietary element. So and of course, Google is awash with different things that we can get even within our own environment, that we can take in as part of our diet that will help that process. Then we have our bitters, and if the person is female, the restore would also help as well along with the bitters. I wanted to recommend that. I mean, for everything that we do, every condition that we recommend, I'm getting more and more, conscious of the fact that we need to educate people on the need to try to go natural as possible, even with diet. That will reverse a lot. It would amaze you how God created the body system to like rejuvenate itself, correct itself. But when we are loading in things that are toxic to the body, processed food and all of that, it may make things really, really degenerate, and it won't help the process that is supposed to effect the regular diet. Just
Okay.
wanted to add this, yeah.
Thank you very much. A question has just popped in. It says into the chat box, it says, is Restore for women only? Yes, Restore is for women only. It's for women's, it restores the woman's hormonal environment, so to speak. It balances the hormones for women. Thank you. Okay, let's go to the next question. Yeah.
Oh, my network made me miss the one for the nerve.
Okay,
I've been
let
trying
me.
to log in with other device.
Okay, have you seen it now? Maybe you'd like to comment before we move to the next one.
Yes, no, the one of the nerve. I think I lost you at the nerve. That one, the man that complained of the nerve after carrying kegs.
Okay, yeah, that's it. Maybe you want to
Uh, yes,
contribute before we move.
yes, I would like to see one. Yes.
Go ahead.
So, yes, like MI said before, my network start messing up. The question sounds like it's a one-off thing. But if I may, if the person is talking about firing up the nerves, what I can see from here is that maybe this person, apart from probably the pressure of carrying that cakes, we can just be something that's just a one-off that can be massaged with the balm. Another thing that one can take into cognizance in something like this is all this microvascular complication of diabetes. Because we see that people that have diabetes has majorly two types of complication. One is what we call the macrovascular, and one is what we call the microvascular. So the microvascular ones majorly affect the nerves. And you see that at times you just be walking, you'll be feeling some things like what Yoruba call paja, and you feel that the blood is not flowing well and all that. So, and when you apply pressure to some of those places, they look like it's dead, like the blood flow to that area is not good. So what I'm going to advise, apart from the fact that you can use some of our products, this person should probably try to run a fasting blood sugar to check if there's a trace of either pre-diabetes or diabetes in this person. Very, very important. This person should run that sugar test. Then, before that result comes out, before you're able to arrive at any diagnosis, which of course you should try to do your urinalysis too, there might be traces of protein in that. So this person can be put on the bitters pending when we see the results. And when we see the results, we'll be able to modify what we are going to do for this person. So I want to add that before my network threw me off the meeting.
Okay, thank you very much. Thank you. Okay, so now, what products can be used to treat stomach ulcer? What is the dosage and duration for treatment? So, who would like to take that? Dr.
Okay,
Nipa.
let me go on. What RIDA products can be used to treat stomach ulcer? What is the dosage and duration of treatment? So, like we always tell our people that don't do anything without trying to seek medical help. So a lot of things that our people call ulcer is not actually ulcer. So we have to be very sure that this person is actually having ulcer. Most times when people say they have ulcer, what they have is likely an indigestion, something we call GERD, gastroesophageal reflux disease. So the presentation of GERD and ulcer they are always close to each other. I always say they are cousins because they are very, very close. So indigestion and ulcer. So if you are certain that this person actually have ulcer that is caused by an organism we call Helicobacter pylori, that means you have done tests, you have established what his diagnosis is. If you are going to be on our products, I always tell my people that my patient I'm putting on this product that have ulcer, that they should not use it undiluted, because I've seen that some people that have ulcer and they use this undiluted might have a little bit of aggravation of it. So it's a two-way thing. This same thing that can cure you, if you don't use it properly, can look like it's aggravating your problem. So dilute it, always dilute it. I always say, okay, a glass cup of water, and you put your 10 to 20 mils in it, it's fine. And you don't even take 20 mils if you have ulcer, take between 10 to 15 mils. So put it in a glass cup of water and you take it. Once again, I always like to start things from first principle. What is the cause of ulcer? Most of us know that it is an organism which is an infection, if it is actually an ulcer. So that Helicobacter pylori is an organism that is infectious. So you are not just going to be on the bitters alone. I always add, once it's a confirmed ulcer, I make sure I add the cleanser to it. So I won't just tell you to be on the bitters alone. I will add the cleanser to whatever you are taking. Don't forget, you still need to consult your doctor. Thank you, ma.
Thank you very much. Yes, bitters and cleanser. Now there's a is MI around? Okay, maybe MI is off for now. Are you here?
I'm back now, ma'am.
Oh, you're back now. Okay. Do you have anything to
Yeah,
contribute to
no,
that?
I think Dr. Nifadi has done justice.
Yeah. Thank you. Now there's a question on the chat box. It says, how long can it take for a anus, so maybe an anus that comes out due to pile with blood, but the blood has stopped, no more pain, but the anus is still coming out when going to toilet? Can he apply the bitters on the anus? Thank you.
I think Dr. Onifade has answered this kind of question before. I think I
Yes,
would nominate him to answer it again, because I mean, there's a degree to which it will come out that surgery that will help. So,
surgery is
uh,
required.
Dr.
Yes.
Onifade, please.
Yeah. Okay, yes. So this question, people always ask these questions. By now, I want to believe most of us should be experts in answering this question now. So like we always say, hemorrhoids has different degrees. There's a first degree, second degree, third degree, depending on how this thing has protruded, and does it come back, or do you have to push it in yourself for it to go in, or it comes in and go out when you are in toilets and all. So we need to know what exactly this is. Is it always there, is not going back at all? If it's always there, it's not going back at all, that means most of those vessels and all of them are weak, and even it's probably going to affect part of the muscles and all. So this person might benefit from surgery if it is permanently there and it's giving you pain and you have to push it back. But if it still goes back on its own, that's after you finish using the toilet, it will go back, it will retract back on its own. You don't have to push it. That is fine. That is like first degree. You can use our bitters for this. And I have experimented some things. There's this sit bath that we always say people should do when they have hemorrhoid, that they should put salt in a warm water, not hot water. So me, I've modified my sit bath. I will not just put salt. What I do now is, initially I was experimenting with bitters. Now I've been experimenting with balm. So when they want to do the sit bath, after I put the salt, I put a little bit of the balm, I let it dissolve, and I say, okay, do so. These are what you can do. If it's not that it's permanently there, you don't need surgery, do your sit bath, use the drug that they prescribe for you, and do that sit bath with the bitters or the balm. It has been getting good results with that.
Thank you. Thank you, doctor. It's very interesting that the balm seems to really have multiple functions these days, multiple properties. Thank you. Okay. Now, for someone who prefers capsule and fat burner, what should the dose be? Sorry. What should be the dosage, please? Capsule and fat burner. Maybe Emma would like to go for
Yeah,
that.
we have standard dosage for both supplements. For someone who wants to use the fat burner, obviously, the person wants to lose some weight. We usually encourage that people use 2 capsules of the RIDA capsule in the morning and 2 capsules at night for about 2 to 4 weeks before introducing fat burner. And when they introduce the fat burner, they could use the fat burner 2 capsules at night and the capsule only 2 caps in the morning. So the capsule morning and night for a start for about 2 weeks just for the body to get accustomed to it before introducing the fat burner, which can be used 2 capsules at night. So 2 capsules in the morning for the supplements and 2 capsules of the fat burner at night. And then we always recommend if you want to see any noticeable and sustainable results in your health, always target to use the products for 90 days, which is 3 months. Last week somebody sent me a message and said, I'm using this bitters and the fat burner. 2 weeks now. I've hardly seen any, I'm not really losing weight. Well, I'm telling you, I was shocked. So we just recommend, I mean, for anything for that matter, just plan to take it for 3 months, which is 90 days. So that's
Okay, thank you. I think there was something in the chat box. Someone said, also, is it all the time that these herbal are taken first thing before food and last thing before going to bed? Can bitters and others be taken anytime?
I think I would like to say something to that.
Yes.
I think it's to it's for safety purposes, and I'm using safety very carefully, not because it's dangerous if you use it afterwards. I mean, if your system is not yet used to it, you don't want to take it after you have eaten, right? Because it may just, you know, increase your bowel movement immediately. So that's why we just encourage, have it in your system for 1 hour before you. For people like us, I've been using for some time. Even yesterday, I took it after I took breakfast. You already kind of, I mean, your system has already adjusted to it. But generally speaking, that's just a rule of thumb, so that you don't have any emergencies, and just to just be safe. That's just my contribution to it. That's why. I mean,
Thank you very much. Yeah, just like even the taking the bitters for a week or two before adding the variant. Again, it's for safety, to just be sure how let your body adjust to it first and know how what effect it has on you before adding the second one. So the next question, well, this has been answered by the person by Dr. Onifade, because the question was asked on the chat box. So what variants can be used for hemorrhoids? Well, basically the bitters, then you can have a sitz bath with the bitters or balm. And I believe if there's any sign of infection, the cleanser could also be used alongside. So let's go to the next question now. What products can someone suffering from infection of the blood, Yorubas call it kokoro inu eje, use? Meanwhile, she was on RIDA cleanser and RIDA bitters and she's feeling serious pains. Who would like to go for that?
Okay, let me go for that. Although maybe I will need to go and collect change from Usage that they did not teach me kokoro inu eje. Well, So let
Maybe
me go. Let me go for that. So
some form of sepsis.
uh, some form of sepsis, yeah. Well, the way this person coined the question, it doesn't look like sepsis because the basic complaint is pains. So when you say someone has kokoro inu eje and this person is having pains, kokoro inu eje sounds like someone that has infection of the blood, and with infection of the blood, one of the prominent thing that will bring it out for us is fever. The person will be running a lot of temperature and all that. So that is one of the way we look at sepsis. But if this person is just having pains, I don't think this is kokoro inu eje. So I think there's something else. This is someone that we need to investigate properly. So this person is already on RIDA, is already on cleanser. So my recommendation would be this person needs to go to the hospital for proper examination to know where this pain is, number one, because we don't even know where the pain is. You only tell us there's pain. Is the pain in the head? Is it in the heart? Is it in the body? Is it in the hand? Is it in the leg? Is it in the stomach? So this is a very vague question that will not make us be able to answer it properly. So if this person that is on this call, the person might get in touch with us to rephrase this question properly so we understand what you are trying to say, because this is very vague and this can be 1 billion things. So we cannot coin this down to anything. Thank you, ma.
Thank you very much, Dr. Nifade. Yes, again, I intentionally included this question just for basically for what you said, for us to realize that even when we're asking questions, it's important to be specific about what's going on, and just the fact that like he said, the person needs medical intervention, medical examination to be able to know exactly what it is. I think somebody has asked a question in the chat box. Okay, it says, can taking only variants like fat burner work without adding bitters? Well, I'll answer that. The manufacturer has recommended that the variants work for best effects. It needs to be combined with the bitters, and basically that's it. So if you if you use it alone, you probably would not get the best benefits of that variant. Thank you. What is the treatment plan for a child an age 6 with sickle cell?
Okay, I would like to answer that. Age 6 is quite young, and I personally have interacted with a number of sickle cell patients who RIDA has been very helpful, in helping their immunity level, even the pains they experience, and all of that. So the bitters largely what they use, as well as the balm, sometimes for the pains they experience. A 6-year-old is quite young, so I would say that for a 6-year-old, maybe 2.5 mil. I don't know. Maybe Dr. Ino would also put in a word there. Maybe 2.5 mils, say like 3 times a week or so. Maybe maybe ideal. Mix in water and take. But I'm aware that Reader has been very helpful. I've had a couple of people with sickle cell, men. You know, I have about 2 men who even use fire, and they've had it's really helping them. Who are episodes of crisis and all. So for a 6-year-old, I would say maybe 2.5 mils of the bitters mixed in water, maybe 3 times a week, thereabout, spaced, over a week.
Yeah. Yeah, I thank you, Emma. I think so too. I think that also depending on the frame, the weight of the child, could start with 2.5 mils, maybe graduate a little bit higher over time to maybe 5 mils 3 times a week or 2 times a week, diluted. So yes, it has, RIDA bitters has been very helpful for sickle cell patients. So the next question says, can bitters be administered for typhoid having completed orthodox medicine and the stomach pain does not subside?
Yeah, I'd like to say something about that.
Okay.
Yeah, completed orthodox medicine. Okay. It's one of two things. The person can commence that have typhoid. They seem to like have it a lot. And I usually would advise someone who battles that, whether they go back to using another full dose of orthodox medicine, to try and do a 90-day bitters and cleanser. Yeah, yeah. So I believe it will be helpful. Bitters and cleanser will be helpful. Twice a day for bitters, once a day for the cleanser. Use over a period of, and I think after 30 days, the person can go check and see the progression of how things are going. For typhoid, you can easily see, where you were and where you're at, and you can take it on. A lot of people and of course, diet is a very strong, part of this. I don't think there's anything I'll talk about now that I won't address the diet bit. So people that have typhoid from time to time to time, I think they need to be more particular, about what they drink and what they eat. But I know that bitters and cleanser will be very helpful in, in this for this person.
Thank you very much, Emma. I would like to say one or two things about it because of the typhoid. I'm of the opinion, and maybe Dr. Onifade might also want to comment on that, that typhoid fever, typhoid in this environment is overdiagnosed. A lot of people go to the hospital and they do what they call a typhoid test. Unfortunately, the typhoid test is not the gold standard test that diagnoses typhoid. Typhoid is common, but it's not as common as it is made out to be. To actually diagnose typhoid fever, you need to have a positive blood culture or stool culture and grow the Salmonella typhi or paratyphi there. So what I'm saying is that this person may not actually have typhoid fever. They may have something else. It could be a virus, it could be a viral infection, But I guess if if you've completed the treatment that you've been given and it doesn't subside, I think it's important to look further to see what it could be. But definitely, while doing that, before doing that, reader bitters and cleanser would help. Dr. Onifade, are you there? Would you like to comment? Okay, I think Dr.
Yes,
Onifade.
ma'am, I am here. Yes, I'm here. Can you hear me?
Yes, we can hear you.
Yeah, actually a question I really want to comment on, because this typhoid thing has turned plenty of hospitals into millionaires and billionaires. Because
Yeah.
for some reason, people just want to be diagnosed of typhoid. Once they treat malaria and it's not going, they just want you to label them that you have typhoid. And I don't know if it's a bragging rights that our people say, I'm taking 15 drips for typhoid. I've taken 45 injection. I don't know why our people pride themselves in those things. And the truth, like you rightly said, is that most of these things are actually not typhoid. If most of us see what a typhoid infection is, we are going to run away. And depending on when the person gets this typhoid, this is real typhoid, there are 3 specimens we always use in making a real diagnosis, which is the blood, the physics, and the urine. We call it BFU. So you need to have those results for you to actually label someone as having, for depending on when you are catching the person, how early you are catching the person will determine the test you are going to do. So this by the side lab test that we do, that they will just do just put your blood and quickly on a yeah, all these fast tests and all that. It doesn't really give anybody typhoid. It's not really a typhoid diagnosis. If you take blood of goats and take it and run that test, you see typhoid there. It will read 1 in 160, 1 in 180, and all those things. And you say, everywhere is red, it's typhoid, it's like. So when it comes to abdominal pain, most of the time, it is actually a virus, most often than none. As Dr. I know has rightly said, it's actually a virus most of the time. So if you have tried our bitters or the cleanser because of the effects on virus and all that, some of them are self-limiting. They will just go. Most of viral disease don't even have drugs. Most viral infections don't have drugs. They were self-limiting. They will take their time and go. But if it's not going for a particular period of time, go to the hospital, get a proper investigation done. Don't just be labeled as you have typhoid, come and take 60 drips. It is wrong. It is wrong. Please let us take this away from here today. Thank you, ma.
Thank you very much. Something else I'd like to add regarding the so-called typhoid test that's being done. It's called the Vidal test. What is significant? I mean, most people, I don't know why, most medical practitioners would do once and say, oh, you have 1 in 160, it is typhoid. What is significant is if you have what we call a rising titer. So today it's 1 in 80, tomorrow it's quadrupled to 1 in 320, then you can say the person has typhoid fever. But for one test to say it's typhoid, it's not likely. So it's just to add that, I mean, to lend my voice to the fact that many of these conditions that are called typhoid are not typhoid. Thank you.
Sorry, I would like to add something. Sorry. Yeah, and I'd like to say that, I mean, just to add to what has already been said, this kind of moves, just give an opportunity for people to load their systems with antibiotics, load their systems with a lot, that your internal organs will now have to want to do a lot of work on. And at the end of the day, what we call oxidative stress, different things happening in the body, will begin to show up. So, many times when you say, I have this, I have that, and you make yourself available for, well, I've never had typhoid before. I've never been, I don't know. I could have it a lot. I mean, so I think, don't make yourself available for different, I mean, loading antibiotics. Does a lot of work for the heart. The liver has a lot to do, all of that. So let's follow the advice of our doctors, please, and not be quick to just, load our system. It has its own negative effects as well.
Thank you, Emma. Yes, typhoid. I know that in practice I've seen very few confirmed cases of typhoid. So, okay. What can be taken for joint pains? I mean, this is a quick one. Basically, the bitters and the balm can be taken for joint pain, but others can contribute.
You have said it, man.
Yes,
You have said it. Once it's pain, cannot
yeah.
be wrong with the balm. The balm, the almighty balm,
Almighty.
almighty little balm.
Thank you. Okay. Can a new mom use the bitters? Again, a quick one. Am I?
Okay, a new mom, is a new mom breastfeeding? I assume that the new mom is breastfeeding, and if the new mom is breastfeeding, it's not advisable to take any of the orally consumed RIDA range of products, because you would get secreted also in the breast milk and the child will take it. So we don't recommend that. I know that many people want to get back into shape, the tummy is big, this and that. Even the process of breastfeeding helps the uterus to contract and all of that. And in the time when you're done breastfeeding, you take, take or you can take bitters. But while you're breastfeeding, it's not. In the meantime, I mean, I've seen like there's a particular lady who after she gave birth, her skin just, I mean, of course, normally your skin is darker when you're pregnant. When you're after giving birth, it will gradually lighten up and all, But her, she just had these very bad rashes. Very, I mean, I think the baby was about 8 months or so, but she was still breastfeeding. So I just told her, uh, get the disinfectant using water, use a body wash, use the body butter, and her skin is gradually coming back. She's still breastfeeding anyway, so she can't take all of that, but I mean, it's gradually helping her skin to come back. So if it's for any cosmetic reason, the person can take any of the personal care products for now, until they can go.
Okay. Thank you very much. So the last question on the on that we have here is, which of the reader ranges helps with vitamin D?
Yeah, I'd like to. I know I had a conversation with Dr. Eno about 2 or 3 days ago about vitamin D. I don't know. Maybe we need to make this, but it's quite obvious. But maybe we'll need to make it a bit more the supplementary facts and all. Make it a bit more public. Maybe like have a slide or a graphics that shows that the bitters is actually quite rich in vitamin D. There are a couple of vitamins available in bitters. It's actually very vitamin and mineral rich. Bitters is quite rich in vitamin D.
Thank you very much. Yes, I was quite pleasantly surprised to see that the bitters capsules, 2 capsules, actually contains about 379% of what we need daily for the vitamin D daily requirement, and that shows that makes one understand why it would boost the immunity. I mean, the conversation goes on within doctors, medical personnel in this country, that there is something that is protecting us from COVID. I mean, not that people are not having COVID, not that people are not dying of COVID, but here the amounts, the numbers of people really coming down with COVID are not as much as expected. Even areas where there's overcrowding and all that, and we're thinking it could be vitamin D. And to see that Rida contains a high amount of vitamin D is quite interesting. It also contains vitamin B7, biotin, which helps with the growth of hair and all that. So yes, so it's the Rida bitters that helps with vitamin D. I think we have one question in the chat box. It says, can children use bitters? If yes, from what age? At what dose? And can it be taken by them, not necessarily treating any ailments? Okay, it says Emma is not audible enough, ma. Emma,
Yeah,
maybe.
I already.
Okay.
Okay, so let me just put an answer to that because before others also share. Yes, children can use the betas only. As from age 4, they can use it, and also because even though we try, even some things that are grown in the farms now, they are not as natural as they should be. So just for the pure need to want to help the children detox, they can take it just once in a week. Um, like I would normally, my children, my older children are grown now. But if they were younger, they would take it on maybe on Friday night or Saturday mornings, just once a week. So for children from age 4 upwards, 2.5 meals should work for them. If they're not eating anything in particular, once a week works. Otherwise, some parents know that their children consume quite a bit of different things. So if you want to increase it from once a week, you are very welcome to do that. But averagely from 4 once a week, you're just a wonderful person.
Okay. Thank you. Dr. Nifade, do you want to say something? Okay, I thought his mic was. So,
Okay.
yes, yeah, go on.
Yeah. Are you there?
Yes.
Yeah. As we are rounding up, I want to do the last question. So let me just say something about the vitamin D. This vitamin D issue, and this bitters is just so powerful. And at times I let people know that vitamin D is actually not a vitamin per se. It's like a pro-hormone. What do I mean by pro-hormone? Is a precursor for some hormone to be produced. So, and it's not what we routinely get from the body. So you have to consume it. And if you look at the origin of these bitters, we say that we pride ourselves that we can get our product, the things we use to make from vegetables and things we see around. So from consumption of all these vegetables and immediate things around us, vitamin D is present in quite a lot of them. And that is why when we say our bitters is good for as very strong antioxidant for people that have COVID or to prevent you from COVID, quite a lot of people marvel at us when we are saying that. And that can be explained because of the effect of vitamin D on COVID-19. And basically on the hormone, because of the way it acts as a pro-hormone to produce some other things that make your immunity to get stronger. So, of course, I'm not surprised if there's a whole lot of vitamin D in these bitters, because even from its work, it's quite evident from the way it boosts immunity, the way it works. So that's why I encourage people that we don't need to wait until something is wrong with us before we take these RIDA bitters. It should be part of our daily routine, the way we are eating, the way we are drinking water. Even if all you are doing is just 10 or 15 meals a day, this is going to help you when you don't expect it. The immunity is going to come into action when you don't expect it, because the vitamin D is helping build the immunity and helping some hormone to come into action at the time they are needed. Thank you, ma.
Thank you very much, Dr. Nifade. Yes, I mean, just to reiterate, Yoruba say there's a saying in Yoruba that says, "Kéèyàn pọ́nmi dòǹgbẹ." That is, you fetch water before you get thirsty. And so use your reader before you get ill. When you're well, boost your immunity. I think there's a testimony here. I'll just read it before we round up. Somebody says, I have used bitters for a child who used to have boils all over the body. She would be admitted in the hospital, taking drips for about 3 days. Now no more boils. Another child had measles, used it. So yeah. Thank you very much, Mrs. Abiodun Daramola, for that testimonial. Wow. One last question says, I just met someone who has pneumonia. Okay, pneumonia. What can be used? What can be used? First of all, I'll allow the panelists to talk, but first of all, the person needs to actually be properly diagnosed, have a chest x-ray, see the doctor, and know that it's pneumonia. Then go follow doctor's advice. But after that, our products can be used. I just want to allow MI or Dr. Nifade to say something before we round up.
I've said it, ma.
Okay, okay. All right. So thank you all very much. That's all we have time for today. I hope we have learned quite a bit. You know, like we say, the answers, the questions are the answers. And I believe that our knowledge has been enriched this evening by the answers to these questions. We take the questions people have over the weeks and months, and we put them together and we answer them here. I want to thank our panelists for being here. MI, thank you very much. Dr. Nifade, thank you very much. Dr. Nifade is actually at work and he has taken time out to be with us here. Thank you all very much. I don't know whether we have any guests in the house, but I believe if we have any guests, You've had a great time. We thank you for being here, and our members, I hope we have learned quite a lot about even the fact that we need to ask a lot more questions when somebody presents with something, a condition. Even before we escalate it to any of the medical team, let's ask a lot of questions. Thank you all very much. Yes, we will have the recordings. So I think I'm going to stop recording now.
Thank you very much.
Um,